Hi there, my name is Dr. Carly Axford and I'm the founder of the Spinal Flow Technique. And I wanted to do a video today on Spinal Flow Technique and how that can help you if you do have painful or irregular periods. And you might be thinking, how has that got to do with the spine? But in my experience and the people that I've worked with, often if people had irregular or painful periods and they came to see me and I worked with them with the Spinal Flow Technique, they got great results. They experienced less pain, more regular cycles, and just felt better in the body. So I want to explain to you why that can be. So really what happens is our body, what we do is we work with the spine and the spinal cord. So with the Spinal Flow Technique, what we look at is we look at the brain and the spinal cord. So it's all the nervous system. So if you think of the brain sends out a spinal cord, and then all the nerves come out and supply every organ and cell of the body. And so the nerves down below here, those nerves are coming out to supply the reproductive system. The ovaries, uterus, all the reproductive system there. So it can be that if there's a blockage through here in the nerve supply that needs to come out to the reproductive system, that nerve supply, if that's blocked right here where it comes out of the joint, it can change the way it supplies, the ovaries, the uterus, and the whole reproductive system. So with Spinal Flow, what we do is we look at assessing to see what's happening with the spine. We look at having a feel of every single vertebra to make sure they're in alignment and to make sure they're moving and to make sure there's not stress stored in the spine. Because what we know is that if there's stress stored in the spine, it may be stored because of physical stress, chemical stress, or emotional stress. But when there's stress that's stored there, that interferes with the joints, the movement, but it also interferes with the nerve supply that needs to come out and supply the organs, cells, tissues, and glands. So with the Spinal Flow Technique, what we do is we assess to see if there's any blockages, and then we work to help you release the blockages. Release the blockages layer by layer, release the layers of stress in the system, and bring the spinal wave in so there can be healing that happens in your body. So what I've noticed with some of my clients that have come in that have had irregular or painful periods is I found a blockage in the power gateway. The power gateway, and often the foundation gateway, the power gateway is the lumbar spine down the bottom. Foundation gateway is the area of the pelvis, and often when there's a blockage in that area, it can interfere and affect the health of our reproductive system. So what that looks like for you is to just go and see, to go and actually check out to see if there's a blockage in your system. Because if you are experiencing painful or irregular periods, you don't have to, and we may be able to help you. So I can't say that we can help you just here by watching this video, but if you see one of my Spinal Flow practitioners, they will do a thorough examination of your spine. They will check to see if there's spinal blockages present. They'll have a look at your posture. They'll do a gateway assessment, and they'll let you know exactly if they've found a spinal blockage, how they can help you. And by freeing the spine from blockages, having more ease, less tension, creates more health, more healing, and hopefully less painful periods or irregular periods. So go and find one of my Spinal Flow practitioners. They are listed on my website. Please know if there's not one in your area, then you may choose to become a Spinal Flow practitioner or just join me for some of the self-healing that I teach while you're waiting for someone to be certified in your region.